before continuing with my presentation, I'd like to ask you, what needs to happen for you to feel safe to disclose anything that is uncomfortable? Yes. Oh, okay. So when there is no, so when you know that your family is safe and everything, there's no threat, therefore you feel comfortable disclosing. How about other people? Feeling accepted, you don't want judgment, right? So you want to feel fully comfortable. If confidentiality is reassured, definitely. Anyone else would like to share? If there are similarities as far as cultural, ethnic, and nationality, perhaps religious, spiritual kind of background, sometimes people feel more comfortable disclosing. Sometimes it could be the other way around. Actually, people feel comfortable if they are disclosing to someone from a completely different cultural and religious background, etc., etc. So basically, you've highlighted the points that I wanted to highlight. For the sake of the time, I'm just going to share with you and highlight some strategies based on a culturally competent care perspective. That's what I really do base my clinical work on, because I find that perspective, it's comprehensive. It takes into account a number of factors that can really help establish a trustful and a good working relationship with people from diverse cultural backgrounds. Based on research and some studies, ethnocultural communities, including refugee families, some are relatively vulnerable to mental health and addiction problems due to pre-migration trauma, economic, social disadvantages, isolation, racism, discrimination, and cultural pressures. And generally, which is totally understandable, when you go to a new country, you don't really know much about resources, what's available, what's not. Plus that some they really lack an understanding of what mental illness is, or what addiction is, what to do about it, what are the side effects of doing this or that, taking medications or different approaches. And they generally lack, they're not interested as much to take part in health promotion, prevention or treatment programs. I've included two definitions of cultural competence. You can review it later on. We can move to the next slide. And this is the Quattro Patek framework. It's one of the billions of culturally competent care models out there that I have chosen, and I find it pretty comprehensive because it encompasses really significant components of providing a culturally competent care, which includes knowledge, skills, power, awareness. And at the heart of that, you can see that it says equity, and I wonder if people know what that means. Equity is different from equality. Most of us, go ahead.
Same opportunities.
Having same opportunities. It's part of it, yes. Anyone else?
Fair rights.
Fairness, yes. Yes.
Balanced knowledge.
Balanced knowledge, yes, it could be part of it. See, like for instance, most people, maybe everyone here has access to health care, right? You have OHIP card, you can go and see a physician, you can go to the hospital without paying for it. But are you getting the care that you need? We don't know that, right? So that's what sits at the heart of a cultural care perspective, providing equity. So it's not just about access to care, but it's also the quality. It's not just the quantity, it's also quality. So one important component of cultural competency is that do I know my own values, beliefs, biases, assumptions? We all make assumptions. We're constantly judging, aren't we? So-and-so is wearing this, it's a bad color. So-and-so is saying that, I don't like that. So-and-so did this. Why is this person like this? So we make a lot of judgments constantly. Sometimes we're not even fully aware of what we're saying, what we're thinking. So it's really, really important. It's actually the foundation of helping others, I think. Otherwise, we might be doing a disservice, is that you need to know your own stuff, good or bad. And then ask yourself, do I feel comfortable working with refugee families? What's your view of refugee families? Are they people that are weak, unable to bounce back, there's no resiliency, etc., etc.? Or do you see a lot of strength in refugee families? Do you also see that people are capable of bouncing back and adapt and adjust and learn and contribute? So how do you view refugee families? It's really, really important. And are you aware of power dynamics? This is also significant. I guess everything is significant. You have to keep in mind that when someone migrates to a new place, especially if there's totally different language, totally different culture, basically everything is different. They've been displaced or whatever, for whatever reason, either wanted or unwanted, either for political, economic, social reasons, or a combination of things. It does not matter. Is that power dynamics shifts, status changes, and that hugely impacts someone's expectations and their well-being and their ability to adjust. And so self-reflection, it's really beneficial in terms of knowing yourself, getting to know yourself before you make an attempt to get to know the other. So basically, these are recommendations, the attributes that would be really useful if you choose to work with someone, to be in a position that you need to help someone else. If you can, for a moment, we're going to do an activity very quick. It will only take a few minutes, maybe less than 2 minutes. I want you to close your eyes and place yourself in a totally foreign country, foreign continent. You don't speak the language. You don't understand anything. You're not able to read anything. You're far away from your family and friends. You're not familiar with wherever you are on the street. And you're trying to find the nearest motel. And you're trying to ask someone. You do not speak their language. You don't understand what they say. I want you to stay with that feeling. What does it feel like? And also become aware of your thoughts. What thoughts come up for you? So now you can stop and bring yourself back to the room. So how was the experience for you? Frustrating, why? Yeah. It's hard, eh? Like you're trying to ask questions because that's how we communicate as human beings. With language, right? Yes. So you felt completely lost. What about other people? Yes.
Very anxious.
Very anxious. Mm-hmm. So based on what people have shared so far, it hasn't been a very pleasant experience, I assume. Mm-hmm. It's been frustrating, uncomfortable. And you can imagine, you can only imagine someone else's experiences when they move, they come here, they walk into your office, they sit down, and then what do you expect? to just open up and share, or to just do what you ask them to do. So putting yourself in someone else's shoes, it might be helpful to a certain extent, but we can never walk in someone else's shoes. We've never taken that journey. I think other presenters have already gone over a number of points here that I wanted to highlight. So it's important to understand, to get to know the person. But I think the most important thing is that your intention. Know your intention, know yourself, and what are you hoping to get out of this communication? What's your intention? Is your intention to help? Or is your intention to pass on judgment? If the intention is clear and is positive, and you show respect, you treat someone else with respect and dignity, and you express interest to get to know the other person, to listen with a non-judgmental attitude, with compassion and care, everything will work out. And I've seen that happen over and over and over and over. So it's not, as Dr. Payne was talking about, not really thinking of ourselves as an expert, that we know it all. We know what the answers are. We want to work as a team. We want to collaborate. So you want to ask questions. You don't want to make assumptions. So keeping in mind that the refugee families might have gone through or still going through a lot of stuff, like social determinants of health are really, really important stuff. Imagine yourself not having a roof over your head, no food on the table, then what do I expect? You to start working on your gambling issue? It's not going to work out. You need those basic needs to be fulfilled. It needs to happen. So keeping that in mind is also important, providing resources, knowledge, as Vince talked about, offering education, but in a non-judgmental attitude. They're struggling with a lot, some of them, right? So we've talked about it. You've heard that. But there's also, there's a lot of stuff that they've gone through, but refugee families also have a lot of strength. Sometimes people forget that, hey, I can do this. I'm capable of doing this. Sometimes we forget that, we're very actually resilient. We're able to bounce back. We're able to overcome a lot of challenges. People need reassurance. People need to feel safe. Safety is really, trust and safety is the foundation of a relationship. Otherwise, nothing else is going to work out because it's so unstable. So basically, I think we've covered all of these strategies. And just wanted to, can we go back to that example? So this is just an example. I remember I arrived in Canada as a refugee. And and sometimes, I can hear, Ali, that some people want, like some Iranian people want to see me, want to talk to me. They don't actually mind. But some, they don't want to have anything to do with me. They don't feel comfortable. But I can, I don't want to say that I know it all or that I can totally understand what refugee families have gone through or newcomers. But I can empathize. I can really connect because I've gone through some of the stuff that they have gone through as well. But not to say that someone else who has not gone through those stuff that they're not able to connect. As long as there is that intention, there's empathy, there's no judgment, I think we're able to connect. Like some people ask me, because I work with the gambling program, they ask me, have I ever had gambling issue? And I say no. And then I provide them with this example saying that if someone has a cancer and an oncologist is treating that cancer, so that oncologist has to have gone through breast cancer, uterus cancer, etc., to be able to help you. So no. But as human beings, we're able to connect because when we create a safe and trustful setting, then we're able to connect. And the intention is good. His intention is not to cause harm, but to be as helpful as possible in collaboration as a team. So people would ask me, we make a lot of assumptions, all of us, and people would assume that I'm Muslim and I'm practicing and et cetera, but like in a country like Iran, there are religious values and there are cultural values, and they're different. They're not the same. So keeping that in mind, so you want to get to know the other person, you want to know their values, their beliefs, and you also want to keep in mind that there are individual differences. So just because someone is from so-and-so country, that doesn't mean that everybody is the same. So keeping that in mind as well. And I don't know how much, okay, 1 minute. So I'm not going to go over the rest of the slides. There's no time, but you have it in your handout and is available on CAMH website. These are just some tips, communication tips for you to review. And one thing that I really want to emphasize is paying attention to non-verbal ways of communication. So nothing fancy. Just because someone does not speak English, that doesn't mean that they're unintelligent, they're incapable. So, keeping that in mind, it's important, and use simple, basic language. And I think being humble, it can also create a safety zone for people to be able to disclose and share and connect. And I think Stacey touched upon this, explaining your agencies, your role, your agency's guidelines, rules, and all of that, because some people have no idea what counseling is, and how do we function here, like the issue of confidentiality, like kids over age 16 not knowing about your child. Like there's so much that they lack that knowledge. So I think Wins have touched upon that, to provide education and information could really be useful and helpful. So encourage resiliency and strength, offer support, offer hope, normalizing as well. Like, it's not going to stay this way. There are many people that are going through the same issue. That kind of stuff, I think it could really be helpful. That's about it. Thank you.